Your MRI is lying to you. Let me say something that might shock you. Your MRI might actually be the reason you're still in pain, not the solution. And I'm not exaggerating. In fact, what I'm about to explain is exactly why so many people stay stuck in chronic pain, get unnecessary procedures, or even get worse after being told what's wrong with their spine. So if you've ever had an MRI or been told you have a disc problem, you need to hear this. Here's the truth that most people, and honestly most providers, don't fully explain. MRIs show structure, not function. Let me break that down. An MRI can show things like herniated discs, bulging discs, degeneration, and arthritis. But here's the kicker. You can have all of those things and have zero pain. This is an opinion. This is backed by research. There are studies showing that people walking around with no pain at all have some of the worst looking MRIs you've ever seen. And on the flip side, I see patients every week in severe, debilitating pain with normal MRIs. So now the real question becomes, if the MRI doesn't always match the pain, what's actually causing the pain? This is where things start to click, because pain is not just about structure. Pain is about function. And there are four major things MRIs completely miss. 1, the nervous system. Your nervous system controls everything: pain signals, muscle activation, coordination. If your nervous system is irritated or dysregulated, you can have pain with no structural damage. MRIs don't show nerve function, they show anatomy. 2, muscle imbalances and movement dysfunction. You could have tight muscles, weak stabilizers, poor movement patterns, and that creates abnormal stress on joints and tissues. That leads to pain. But guess what? MRIs don't show how your body moves. Number 3, inflammation. Inflammation is one of the biggest drivers of pain. You can have systemic inflammation, local tissue inflammation, poor recovery response. And your MRI might look fine, but you still hurt. Why? Because inflammation is biochemical, not structural. 4, tissue healing capacity. This is a big one in functional medicine and regenerative care. Your body's ability to heal depends on blood flow, nutrition, hormones, cellular repair mechanisms. If your healing capacity is compromised, even a small issue can feel like a major injury. Let me give you a real example from my clinic. I had a patient come in who was told they needed surgery based purely on their MRI. They were scared, in pain, felt like they had no options. But when we evaluated them properly, we didn't just look at the MRI. We looked at joint mechanics, muscle function, nervous system balance, inflammation levels. We addressed the actual dysfunction. And guess what? They avoided surgery completely. Their pain improved, their function came back, because we treated the cause, not just the picture on the scan. Now I'm curious. Drop a comment below. Have you ever been told your MRI explains your pain? Or maybe you've been told this is just something you have to live with. I want to hear your story because I see this happening way too often. Here's the bottom line. An MRI is a tool, not a diagnosis. It's one piece of the puzzle, not the whole picture. If you're dealing with pain and not getting real answers, you need someone who looks at function, movement, nervous system, inflammation, healing capacity. That's exactly what we do. Call us at 209-888-8602 or visit fusionhealthapc.com. Let's actually fix the problem, not just label it. And if this helped you understand your pain a little better, share this with someone who's been told their MRI is the whole story, because it's not. And they deserve better answers.